Hi, this is Kathy Philbin here from West Palm Beach, Florida, and I would like to talk to you today about some updates on the coronavirus and breastfeeding, because we all know that breast milk is the best for the baby, and there are some different changes and ideas that are out there. The World Health Organization and the Center for Disease Control have both stated that they do feel that breastfeeding is still important even if the person has been diagnosed with the coronavirus. So it depends on the situation, and you also have to confirm with the pediatrician, or if you're still at the hospital, the neonatologist, in regards to what their advice is. But here are some thoughts that possibly you could do that may help you be able to still breastfeed while you're in the hospital or at home and you've been diagnosed with the coronavirus. So even if you don't have the coronavirus, we've been stating all along that prior to breastfeeding, you should always wash your hands. And it also prevents mastitis, which is a breast infection that many women do suffer from. So wash your hands for at least 20 seconds prior to breastfeeding, or prior to touching anything that the baby would actually be coming in contact with as well. So you're going to wash your hands, and if you've been coughing or sneezing, then you're going to want to remove any articles of clothing that you've been wearing that would have been exposed to the infectious droplets from your nose or mouth. So you would, change your clothes. And you may want to even just take a soapy, warm washcloth and just wipe the breasts off, rinse, and dry them. And then after that, then you can comfortably breastfeed your baby, but you would want to still also make sure that you're not breathing on the baby or coughing or sneezing on the baby. So we recommend that you wear a face mask. So there are different types of face masks out there. This is just a cloth mask. So the cloth mask will do, it actually doesn't protect the person from getting the coronavirus, but it would protect others from getting it if you had it. So just make sure that it's fitting under the chin, over the nose and mouth, and that it's a good snug fit. The other types, you've seen them around, and it's pretty simplistic to figure out, but these go around your ears, and there's a little metal piece that goes over the bridge of your nose, and you want to make sure this fits tightly over your nose, mouth, and under the chin. And then there's this type as well that you could choose from. Then we also have a shield, and this is like seen at the hospitals often, but this would go over and it would be over your forehead. And while we're talking about masks, I actually heard from someone that they were talking about actually fitting babies with a mask with a pacifier built into the mask. This is not recommended at all by the CDC or WHO or any pediatrician, neonatologist, anyone in the healthcare facilities that govern these ideas. This is just not a good idea. I don't know if this was a joke, but it really is not a good idea at all. They're recommending that children above, like 2 or above, and that you should always be watching those children as they're wearing the mask too. Just for the same reasons, we don't want any child to suffocate while wearing a mask. So back to the breastfeeding though. The other thing besides good hand washing, wearing a mask, washing the breast, is also washing any equipment that has contact for the baby. So you want your pump to be clean. You want all the equipment that you use, like the breast pump tubing and the apparatus that you use to fit over the breast. All of that has to be cleaned with hot sudsy water, and then you can just put it on a paper towel and let it air dry. But it's really important that you continue to keep everything clean and not contaminated. So You can still do all these things and still continue to breastfeed, or you can pump the milk and you can have breast milk be given either if you don't feel healthy enough to give the baby the breast milk via the bottle. Another person who lives in the home that is not sick could also feed the baby for you. And just remember that soon, hopefully, this will too pass. Just keep the hope and the faith, and know that actually you are still doing a good thing for your baby by breastfeeding. And I wish you all well, and I hope this has helped with a little bit more information. And if you have the time, subscribe to our channel below. Take care, and thank you. Bye.